report is looking at the current crisis in healthcare, but also at the government's programme for change to introduce a new governance structure, but also universal healthcare insurance. So what the report is looking at is really a critique of the government's plans. They've been ill thought out. There's been a failure really to deal with some of the underlying structural problems in the healthcare system, including years of neglect of funding, poor planning, difficulties in delivering strategic priorities. But despite all of the cuts and the austerity measures, there's still some fundamental problems that haven't been sorted out in the healthcare system. So moving towards a new directorate structure could just be another set of reforms like the failed HSE experiment. But also plans for things like independent hospital trusts have not been thought out properly in terms of staffing levels. I mean, the whole objective is to have independent trusts with their own boards and staffing levels and budgets. These haven't been properly thought out yet. The second element that is of concern is the whole programme for universal healthcare insurance. While many people have been calling for universal access to healthcare in Ireland to end the inequitable two-tier structure, there's a real problem in terms of the model that the government is adopting, which is really a competing insurance-based model. It's based on a Dutch model that has really failed. It's led to effectively a three-tier healthcare system where some people are insured and then there's differential levels of insurance in place. And there's no evidence to show that this competing model actually does control costs or lead to better quality of care. So the report calls for two fundamental changes really. One, to look at a social insurance model based on a single payer model using best practice models from other parts of continental Europe that guarantee 100% access to healthcare on a universal basis rather than a tiered structure. And secondly, to rethink the governance structure that the government is planning, because there's been very little thought into how the different elements of healthcare, from mental health services, primary care, health and well-being, will integrate and coordinate a better quality healthcare system in the future. So we're asking for fundamental changes. The report asks for fundamental changes in the way the government is thinking about its reform programme, but most importantly, for there to be consultation and information about it, because there's been a real dearth of information and no consultation really with service users, patients, professional organisations, staff, trade unions, all of whom can contribute to a better quality healthcare system based on solidarity, respect, trust, universality and accessibility.